we good? Okay, so this one's gonna cover two muscles. It's gonna cover trigger point on the lateral deltoid and on the supraspinatus, specifically over the supraspinatus tendon. The origin of the lateral deltoid will be the acromion process of the scapula, and it will insert onto the deltoid tubercle. For the supraspinatus, the origin would be the supraspinous fossa along the top side of the shoulder here, kind of in the groove in between the spine of the scapula. Sorry about that. It's in between the spine of the scapula and more so like near the collarbone, but we're sitting right in that groove of the supraspinous fossa, and we're going to insert onto the greater tubercle of the humerus. So in order to work these muscles, we're going to put them on full stretch. So I'm going to have Kristen almost like interlace your fingers like this, and you're going to reach this arm or help use this left arm to pull her right arm across her body. This is going to lengthen the muscle to its fullest extent. So in order to understand how to lengthen the muscle, we also have to understand their functions. So the lateral deltoid and the supraspinatus are primarily abductors of the shoulder. So we're going to adduct the shoulder as much as we can. And the supraspinatus is mostly active between 0 and 10 or 15 degrees, and also up at 90 and 110 degrees or so. Meanwhile, the lateral deltoid is a prime mover in abduction, so it will be active through the entirety of the range. When I go ahead and do the trigger point on Kristen's shoulder here, I'm going to start down near the deltoid tubercle, and I'm going to work my way up, and I'm going to have her kind of passively move her own arm so that her right arm is relaxed, but her left arm is doing the work by pulling it. And as I'm working the bottom part from the deltoid tubercle on up towards the greater tubercle of the humerus here, this is mostly deltoid work, but once I hit this greater tubercle of the humerus on up to the acromion, we're mostly working trigger points in the supraspinatus tendon. And I will tend to find more trigger points on up in the supraspinatus in this area, and to a lesser extent the lateral deltoid, but I still tend to work the entirety all the way from the bottom here up to the top. One of the ways that I know that I'm on the supraspinatus tendon here is when I go over it, I should feel a jumping of the tendon when I do some cross friction in this area. And that's how I know that I'm directly over top of the supraspinatus tendon, which is right here. And I can go ahead and work that with techniques that are in parallel, or with the fibers, or with a cross friction technique that goes actually perpendicular to the fibers as well.